women do too. Dr. VJ is here to tell us what causes hair loss and how we can prevent it. Good morning, doctor. You know, in the world of television news, the hair is everything. And if someone was to lose their hair or it starts falling out, it could be a major disaster and cause for concern.
Right.
And but other people out there obviously worried about hair loss.
Sure.
What can be done? Is there anything that can be done to prevent it?
Yeah, you know, there certainly is. As with most things in medicine and life in general, everything is a combination of your genetics and your environment. Obviously, so far, we have no way of doing anything about the genetics in terms of changing it. That may occur down the road, but not yet. But we can certainly do a lot of things to prevent it. Proper hair hygiene is real important. What does proper hair hygiene mean? If you're a person who suffers with, itchy, dry scalp and dandruff, it's real important to control it, because recently some studies have come out that show that how we treat our hair and how we protect it can actually go a long way towards stemming or diminishing the chances of early hair loss. So you want to treat your dandruff and you want to treat your itchy scalp so that you don't itch it too much and cause fibrosis that worsens your hair loss in the future.
And what is the big deal about it's just all apparently dead? The hair is dead. So
right.
What?
I mean, the hair itself is dead. It's protein, but what's living is the little hair follicles that's underneath your scalp. And the hair follicles go through different life cycles, and some of them are asleep for a little while, and then they become active. So just because you have certain times where you lose a lot of hair doesn't mean that those hair follicles aren't going to come back and secrete hair in the long run. So biologically, the function of hair at this point is not that great, but obviously it's a big concern for TV reporters and for people in general. You don't want to lose hair when you don't have to.
Absolutely. And what about some of those cures out there that are either in a bottle or in a possible surgery type setting? Is there anything out there that works, and what would work?
Well, there certainly is. If you go through the initial step of controlling your dandruff and eliminating it and making sure your nutrition is adequate, and if you still have hair loss, the first thing to try is shampoos and creams. Minoxidil is available over the counter, and depending on the type of hair loss that you have, it may be very effective. So you want to start off with that. There used to be some pills and other medications that we used to prescribe for this. You want to be careful about that. You want to talk to your physician, because there are some potential side effects for those pills. Now, hair transplant works wonderfully, especially if you go find somebody who's a reputable hair transplant surgeon. There's some newer techniques out there that do very well, and it's important to start early. You can't wait till you've lost all your hair. When you see and notice hair thinning, you want to get started on this treatment first in controlling your dandruff and proper hair hygiene, then potentially trying some of those creams, and then moving on.
Okay, well, good advice. Well, thank you, Dr. VJ, for showing up. If anyone out there has a medical question they need answered by the doctor, email us here at the station or send your question to our Facebook